Good afternoon. Welcome to IRA-TV. I'm Dr. Parthajit, one of the consultant rheumatologists working in Calcutta. This is a great pleasure and honor to interview Professor Liza Rajasekhar, who's one of the stalwarts and pioneers in the field of rheumatology in India. Ma'am, I'll ask you a few questions. You have a special interest in lupus and lupus nephritis. So how would you think the management of lupus has evolved over the last few decades, and what are the main challenges you face in your daily practice?
The challenges have changed with times. So when we started our career, say around 25 years ago, we would be looking out for lupus. We would be very happy if we had made an early diagnosis of lupus. And we would feel sad when patients would come to us with a delay in diagnosis. So we focused our attention on sending the message of early diagnosis. And then we realized that physicians, as the training improved, physicians became very smart. There was no delay in diagnosis. And so we started then facing the challenge of, difficult to treat disease, refractory disease, and the most important but understated problem of non-compliance. And over the years, we've realized that lupus, the kind of complexity it has, the heterogeneity it has, that each patient in your clinic is a challenge. And you will have to decide whether in those 15 to 20 minutes that you're giving the patient, whether you'll be focusing on their medical problem, on their social problem, on their pregnancy issues. And so it's every day is like a new revelation.
But I think you are closely related to IRACON 2023.
Yes.
So what would we advise for the next conference for the organizers to decide and to develop from there?
I have seen the growth of this conference over many years. And from 1 or 2.6, it has gone to 15.6 now. We've seen always that we invite talent from abroad and we juxtapose them to, people who are working on those fields within India. And this has grown stronger. The science in India has grown stronger over the decades. So I have also personally, put my force behind these 6 because I believe that when we collaborate in special interest groups within India, we will identify the challenges much faster. We will solve them much faster. And our research and our science will progress that much faster. And there will be a continuity from conference to conference. And so I think it's a great idea to have the 6.
Okay, thank you, ma'am. And I think there are several budding and young rheumatologists are coming up with bright ideas. They have a very strong and bright future. So what would be your advice for the young generation rheumatologists?
So I would want to say this to the young rheumatologists that do not define yourself whether you are in a private practice or you're in the academic setup. Always give a portion of your time to research, whether it is clinical research or basic research, wherever you are situated. And put that in print, at least in the Indian Journal of Rheumatology, so that we have the drops which will fill the ocean.
Right. Thank you, ma'am. And lastly, one non-clinical question. So you're extremely busy. So how do you manage your work-life balance in your daily practice or kind of daily life?
So after years of trying to balance work and life, I've realized that there are no boundaries. So you have to basically look at the team around you, your family, and be true to yourself, true to them, and then figure out the best possible path through that.
Thank you, ma'am. Thank you for the brilliant answers. With that, we'll probably close this interview today. We'll sign off. Thank you very much. Thank you, ma'am.